Welcome to our second panel of the day at the Geneva Health Forum. It is my pleasure to be moderating this panel today with Dr. Maria Guevara.
Thank you.
Maria is a Senior Operational Positioning Advisor on Global Health at MSF Operational Center, Geneva. With that, let us begin with this session. Up until today, health policies have been primarily centered on the human body. But the reality is, there's an increasing need to look at the ecosystem that surrounds us so that we can see how it is impacting our health. We live in a cycle, and we have the responsibility as humans to take care of the ecosystem that surrounds us. Because at the end of the day, human health depends on Earth health, and Earth health depends on us. Air pollution, deforestation, food and water insecurity caused by rising temperatures are just some examples. To sum up, if we damage our ecosystem, the damage comes back to our health. This is called planetary health, and its urgency is what we're going to be addressing today. Maria, I will be stepping out of the studio so that you will continue with this session and be a bit more comfortable by taking off your mask. I will come back at the middle of the session with some of the questions from our audience. So yes, please be sure to leave your comments and questions in the chat box of this platform. Maria, the floor is now yours.
Well, thank you for that, Ariane, for the warm introduction. And a very good morning, good afternoon, good evening, wherever you are actually calling from. I'm very, very pleased to be here in the stead of Steve Cornish to moderate this most interesting conversation on planetary health, which many who know me well know that this is a great passion of mine. And I am so honored to be in the company of our great guests. But before I do that, I wanted to first make sure that our audience is actually contributing and putting in their questions and answers, because midway through the discussions, we're going to take you in, because this is a conversation we're going to have, and it's not a lecture of any sort. And so with that, I also want to take an introduction from Steve, who sends his very, very big regrets for not being able to be here in person to moderate as planned, but he wanted to share his thoughts and reflections first as we start to deliberate on planetary health and the humanitarian action. So words from Steve. Humanitarianism is slowly coming to terms with how interconnected global health and planetary health have become. In order to learn from and incorporate these lessons into improved community-centered response and care, it is imperative that we begin by linking interventions and acute and chronic crisis response to the environmental and climate factors which are aggravating suffering the world over. The current COVID epidemic is a perfect example. Seldom do we link the land and wildlife use management issues, which are both expanding ranges and numbers of disease-carrying animals and insects, and bringing them into increased contact in inhabited areas. Steve's presence amongst you today has been interrupted by COVID-related travel restrictions, which were merely misinterpreted. Imagine the unimportant occurrence of that, multiplied by thousands of barriers and blockages beyond response teams' control, which are impacting humanitarian assistance. Then you have a picture of the situation on the ground today. The pandemic has shown us the limitations of a centralized international supply and surge capacity-centered response system on which the current humanitarian model is based. With needs predicted to rise, resources to shrink, access to be hardened, and response capacities to be sorely tested, it is imperative that we exchange, learn, and plan together for a more nimble, localized, and capable regional response to multiple concurrent disasters, which climate chaos modeling predicts will be unequally borne, yet nonetheless our shared collective fates. I look forward to the outcomes from today's deliberations and to working on this issue with many of you present today in the months and years ahead. So thank you, Steve, for these thoughts. It serves as a great starting point to launch our conversations. So to kick off, I'd like to finally introduce our distinguished and great guests today. So starting off with our Canadian colleagues, to whom we are extremely grateful for taking the time to join us despite the ungodly hour for them. With us calling from Toronto is Dr. James Urbinski, who is a Canadian physician, humanitarian activist, author, and a world-leading scholar in global health. He remains an iconic person for MSF or Médecins Sans Frontières or Doctors Without Borders for his work within the organization and serving as the MSF International President when the organization received the Nobel Peace Prize in 1999. Today, he is a professor and the inaugural director of York University's Dadalay Institute for Global Health Research, focusing and driving the research on planetary health, global health and humanitarianism, and global health foresighting. Further north, in the Northwest Territories of Canada and Yellowknife, we have lovely Dr. Courtney Howard, who is an emergency physician in Canada's subarctic, and the first female president of the Canadian Association of Physicians for the Environment. She led the 2017-2019 Lancet Countdown on health and climate change briefings for Canadian policymakers and was the 2018 International Policy Director for the Lancet Countdown. She sits on many boards, but namely Editorial Advisory Board of the Lancet Planetary Health and Steering Committee of Planetary Health Alliance, and has been instrumental in driving a health recovery initiative with the WHO initiative, garnering the support of 2/3 of the world's healthcare professionals. And as if that's not enough, she also ran for leadership of Canada's Green Party, finishing 3rd. So down south, in the Southern Hemisphere, joining us from the Philippines, we have one of the staunchest, most exciting, and most innovative voices for the new discipline of planetary health, Dr. Renzo Ginto, who is Chief Planetary Doctor of PH Lab, a global think and do tank for advancing the health of both people and the planet. He is Associate Professor of the Practice of Global Public Health and inaugural Director of the Global Health Program of the St. Luke's College of Medicine, William H. Quasha Memorial in the Philippines. And finally, closer to home, just over the English Channel, we have Jessica Bigley, who currently leads the policy engagement initiatives of the Lancet Countdown on Health and Climate Change, with a background in public health and environmental determinants. She has worked in global health and sustainability for the past 8 years, including as policy research manager at NCD Alliance and with the International Diabetes Federation on Health Education and Epidemiology programs. Jess has a degree in physiology from the University of Oxford. So since we're speaking about Jess now, I would like to actually turn to Jess to speak to us about helping set the scene on this issue of climate change, health, and planetary health. So with the Lancet Countdown, I know that you guys are tracking the progress of health and climate change. Can you expand on that work that you do? How do you actually do that? What are your findings? And what should we be expecting? Should we really be scared or not? Feel the doom, especially with COVID showing us what the reality might be in the future. Can you help expand on this? Thank you.
Thank you so much, Maria. It's a real pleasure to be here with all of you today. So the first thing that I want to say is that climate change and COVID share some similarities in that they are both threat multipliers. Climate change, of course, exacerbates many of the same risks that cause humanitarian crises, and COVID widens existing health inequalities. Most of the data that I'm presenting today is going to be from last year's Lancet Countdown report, but I'd love to encourage you all to look out for the report that we're launching this year on the evening of the 2nd of December UK time, and we're also delighted to be working with MSF on another policy brief this year on the impacts of climate change in humanitarian settings. To talk a little bit about first climate change as a global threat to public health, and then thinking more about the opportunity. So the global impacts of climate change on health are worsening year on year. In 2018, we saw 220 additional million heatwave exposure events compared to baseline. One exposure event here refers to one heatwave experienced by one person aged over 65, so particularly looking at populations that are already vulnerable. And this is already 11 million more than the previous record that was set in 2015. In terms of wildfires, 152 out of 196 countries saw increases in populations exposed to wildfires from the early 2000s to present day. And we're seeing changes in rainfall pattern, obviously disastrous, both from the perspectives of flood or from drought. And so South America and Southeast Asia have experienced the largest increase in extreme rainfall from 2000 to 2018. And there were areas of significantly increased drought exposure in all 6 WHO regions, and parts of Brazil actually experienced a full 12 months of drought for the whole of 2018. We're also seeing impacts on food insecurity with impacts for undernutrition. A changing climate has seen global yield potential reduced by 2.9% for maize, 3.8% for winter wheat, and 3.1% for soybean crops from 1988 to present day. And then finally, with regard to vector-borne disease and focusing particularly on dengue, so vectorial capacity for the transmission of dengue was the second highest on record in 2017, and 9 of the most 10 suitable years for dengue transmission by 2 particular strains of mosquito have occurred since 2000. All of this, of course, has mental health implications as well. It's not something that we're able to track in the Lancet Countdown at the moment, but I think it's clear, even without data, how serious these mental health impacts also are. To look then at the opportunity of addressing climate change for human health, of course, anything to reduce greenhouse gas emissions is already going to have marvellous impacts for human health in the longer term, but in the near term, we also see co-benefits of emissions reduction, and because many of the sources of greenhouse gas emissions are the same as sources for air pollution. So if we transition to more renewable energy, and in particular phasing out coal, that will improve air pollution. If we remodel our transport systems and we promote active transport, that will also promote physical activity. Public transport is, of course, all well and good as well as electric vehicles, so long as these are reliant on renewables and not taking power from a grid that's powered by fossil fuels itself. And then, of course, finally, to mention food and the need to transition to a more plant-based diet that's less high in red meat, in particular, and processed food. And the Lancet Countdown's featuring a new indicator this year on mortality attributable to red meat and other causes. But I think it's also important to look at the lessons that we can learn from the COVID-19 pandemic and from the response, and especially as some governments start to consider recovery. So I really want to emphasise here that climate health and economic objectives are not just mutually reinforcing, but mutually dependent. We can't have health where we have poverty, and it's clear that it's impossible with extreme climate change. Public health issues can freeze even the most powerful economies. COVID-19 has shown the extent to which a large-scale health threat can jeopardise even the strongest economies and can entirely redefine ways of life. So we really need to be minimising future health threats, whether they're related to infectious disease or the wider health risks of warming climate that I spoke about just now, if we're going to be avoiding a repeat of this. So now, as we're coming to terms with the pandemic and we're orienting ourselves towards recovery, it's time to completely shift the ways that we work and to redefine those paradigms. We've seen that nations can completely realign when they're faced with an acute challenge, and responding to climate change requires a response from all sectors of society, a reorientation of the whole systems, and that when this is done, benefits really can be observed. And the point that I want to close with is that, of course, we need to act on the science, but we need to be investing early. Prevention is far more better and cost-effective early on than a response after the threat. And with that, I look forward to hearing from all of the rest of the panelists, and thank you again, Maria.
The next question is actually going to go to Dr. Urbinsky. James, I'm turning to you because of your incredible history with humanitarian work and activism, as well as being a physician yourself, now an academic. And I think it's very interesting what we see, just spoke about the science, but on looking at this, and needing to do more preventative work. But we know that in humanitarian action, we do a lot of the response. How are you bridging this? Can you elaborate a little bit more on the work that you do, bridging the academia, the science into the actual practice? Very interesting in your research focus. And what do you think the role of research is, and the role of humanitarians actually in research and contributing to finding solutions?
Well, thanks very much for the question, and as well for inviting me to participate in the panel. We've been having some technical difficulties, so I'm just hoping that the echo is not substantive. I'll try to speak slowly so that things can be heard. It's a great question that you've asked me. And What I would say is that in terms of how we understand the problem, it's quite important that we take it from the correct perspective. This is not a minor problem that is slowly emerging on the political, on the social, on economic, or global scale or scene. This is the largest and single most important issue of our time. And it is and will define the future of human civilization. It will also define the future of life on this planet, and how life emerges, how it shifts, and how it changes. I think it's really important to recognize in the scale of human history, of known history, our impact on the planet is so profound that we are literally altering the nature of nature. There are several major driving factors here. One is just the sheer number of us. At the beginning of the 19th century, there were just under 1 billion people on the planet, around 700 million. At the beginning of the 20th century, there were about 1.1 billion people on the planet. Now, we are 7.7 billion people on the planet, and we're adding 1 billion people to the planet every 13 years. As well, beginning in the mid-19th century, this was the onset, or the release, or the emergence of the Industrial Revolution. And the thing that fueled the Industrial Revolution was fossil fuels. And with fossil fuels came massive increases in greenhouse gas emissions. The rate at which greenhouse gas emissions have increased into the planetary biosphere is, if you think of a hockey stick, the hockey stick is shaped like this, and at the end it goes up, way up. Well, that's what's actually happening with greenhouse gas emissions over the last 250 years. And the rate of increase it's not only at an exponential rate, it's almost at a full perpendicular rate in terms of how much carbon is being put into the atmosphere every single year. So, and then the final thing that is really driving these massive changes is the way that human beings live, work, play, and organize themselves. There are huge changes and challenges in the way that human beings organize themselves. And so this interaction between human civilizations, the growth and changes within human civilizations, and then the relationship between human civilizations and our biosphere, this is an interdigitated relationship. And it's one that is symbiotic. We cannot live without our biosphere. And what we do as human beings shapes our biosphere now. And what happens in our biosphere shapes us. And so that is really the critical issue. And what we're seeing is massive increases now in extreme weather events, massive changes and increases in infectious disease, massive changes and increases in food insecurity. And so how we respond to these things are really fundamental. I'll touch maybe later on in the discussion about some of the research that we're doing and how we are working with humanitarian organizations and how we're working with humanitarian practitioners to try to develop new tools, new approaches, and new strategies for adapting to the reality of climate change and the planetary health crisis, and for contributing to mitigation or to reduction of greenhouse gas emissions globally. So maybe I'll just stop there and perhaps listen to some of the other panelists as well before talking further.
Great. Thank you, James. I mean, I think you've already started to touch on some of the solutions as much as Jessica has. But I wanted to turn to our youthful and the staunchest advocate of planetary health, Dr. Renzo Ginto. I know that you have been very, very vocal about pushing the issue and highlighting it to the world at large. And I wanted to get your perspective on how you actually explain. I think Jessica and also James have explained it in a very clear manner, but sometimes even that goes over a lot of people's head. And I just wondered how can you re-explain to us planetary health and your experiences in that, and what can we do as the world to respond to this, and as the physician practitioner that you are?
Thank you so much, Maria. And again, it's really great to be part of this amazing panel. As you know, I'm speaking from the Philippines, which I always describe as at the very heart of planetary health, not just because they both start with PH, Philippines and planetary health, but really the country, the Philippines, is one of the most vulnerable countries in the world to climate change. It's not anymore just a report or an article in the Lancet or in the IPCC. It's actually a reality. And I'm not sure, Maria, if you remember, this month is actually our 7th year of knowing each other. Because the first time we met was 7 years ago in 2013 at the Philippine Department of Health. You were representing MSF, and I was part of the International Organization for Migration. And we're all trying to address the aftermath of Typhoon Haiyan, which is the strongest typhoon to ever hit land in human history until today. And if you remember, during the time, 7,000 people have lost their lives, hundreds of thousands displaced, forcibly displaced. Millions have been affected, billions of dollars in losses. And since then, those affected areas have never really totally recovered. Fast forward November 2020, we're fighting a global pandemic. The Philippines, while we're not at the top of the list, in terms of, global numbers, we've been for some time at the top of, among the countries in Southeast Asia in terms of COVID cases and mortality. But also, just in the past 2 weeks alone, we've faced 2 super typhoons. I'm sure you've seen, the images on TV and social media, maybe in the newspaper, if you're still reading newspapers, while our friends in the other side of the Pacific are celebrating the recent political developments in their country, we've been suffering. In fact, I'm even worried that this, my participation in this panel might even be disrupted if Wi-Fi did not return yesterday, again, as a result of, disaster-related disruptions. So climate change is very real in this country. Planetary health challenges are very real and raw in this country. We're facing them every day. It's not just the extreme weather events. It's also increasing, sea level rise. The Philippine coastlines are also facing the fastest rate of sea level rise in the world. We are also confronting several other hazards. We have volcanoes here, tsunamis, everything. And then you have an infectious disease pandemic, which might not be the last in this century if we don't get our acts together. I always say, this year it might have emerged from Wuhan. Next, in the next 5 years, it might erupt from one of the jungles of the Philippines if we don't really adopt a planetary health approach. And so planetary health is really, critical in this age of the Anthropocene, as we always say. We'll now, James also mentioned that, now it's really us, humanity, that is the biggest force shaping the face of the earth. And enough of romanticizing resilience. In the past few weeks, we've been talking a lot about, that concept here in the Philippines. Oh, the Filipinos, can, bend but not break. They can recover. But these effects of climate change and planetary damage will be happening more and more in the years and months and years to come. And so enough of resilience. We need more accountability. We need more people to really, own this up and really, do our share in trying to avert, future catastrophe. Planetary health is preventive medicine on a planetary scale. And so what we want to make sure in this COVID moment, we recover, but we recover better. We recover to a much better world. I remember Arundhati Roy, the Indian novelist, said, the pandemic is a portal between the old world and the next. And what is that next world that we want? What is the future blueprint? I think we have a new compass that we should take advantage of, and that is planetary health. This recognition that our own health and the planet's health are inextricably linked, and that we should not just think about our, but those that are yet to come, those who are unborn, and that speaks of intergenerational health, which is so central in the planetary health concept. I'll stop there and looking forward to more conversation later.
I love your energy. And I will take this forward to Courtney Howard, who has the same type of energy. And as the practitioner that you are, sitting already in a subarctic, and I know you've witnessed a lot of that, but also in your work with MSF, or Doctors Without Borders, I know that I've seen your discussions in the past and how those actually intersect on very much reminding of us of what is happening in the at the planetary scale. But I also wanted to understand, from what actions do you think we should be doing now from your experience, and maybe also highlight a little bit of the planetary health framing as well, and your role in the alliance. And I think what does that mean really in working in that kind of setting?
Thank you. And yes, I'm so excited to be part of this panel with so many of my favorite people from all around the world, the different parts of my life. James Orbinski, I've told him many times he's one of my ultimate heroes. His book was one of the reasons why I went away with MSF. We've since done a research study together on wildfires. Jess Bigley is a dear colleague from the Lancet, and Renzo has been an injection of energy and someone who's taught me a lot about how we can respond and work best together with high-income countries, middle-income countries, and lower and middle-income countries. So I think this is just a rich panel. And you, Maria, and Steve, who helped to convene the panel, have been huge voices within MSF. So the study that James and I did, which I don't even know, James, I don't know if I told you, it just got accepted. So it's been accepted finally for publication. We've been working on it since before my 7-year-old could talk. It showed that we had twice as much asthma as normal in the emergency department over the course of 2014. And so it was a study we actually undertook because, as a clinician in the emergency department, I was noticing a tremendous amount of asthma. And this summer of smoke went across 2.5 months. So it remains one of the worst smoke exposures that's in the published literature base. We also did a qualitative component to the study where we interviewed, partnered with the Kagatu First Nation and the Yellowknives Dene communities. This right here is Chief Draghi's territory, majority Indigenous patient population, people who live very, very close to the land, who depend on the land for food gathering, mental health, and cultural factors. And they said during a course of community-based interviews that really that summer, living bathed in smoke for that entire time impacted their ability to get outside, their mental health, as well as that of other members of the patient population. And many of our interviewees said, well, is this a new normal? What does this mean for my children moving forwards? And so it was a study very much that was born out of our desire as community-based physicians to take action. And so that's one of the impacts we're seeing here in the subarctic, which is one of the most rapidly warming places in the world. Some of my patients are already coping with temperatures 3 degrees Celsius warmer in the high Arctic, which means all sorts of ice instability and, again, food insecurity. And so as clinicians, we're seeing the impacts firsthand. And what that actually does is it gives us the ability to tell those patients' stories to people who make decisions at larger tables. And we know that the way that people's brains work, stories stick, whereas numbers numb. And so those stories are, in fact, incredibly powerful ways for us to make clear the embodied changes of climate change to decision makers. And so I have the great privilege to go back and forth between this hyper local level and international and national levels where I can speak with ministers of health, where I've spoken with people at the WHO, with other doctors from around the world to change policy. So one of my recent roles was as the head of the WHO Civil Society Working Group on Climate Change and Health Advocacy section. We helped to launch the Healthy Recovery call, as you mentioned, that said, hey, essentially what Renzo was saying, this is a hinge moment in human history, as I've heard James say recently. And we, the world's frontline medical providers, are very alarmed by what we're seeing in terms of the impact of this pandemic, which we know is itself a planetary health emergency, given that it's a zoonotic virus that originated at the intersection of humanity and the rest of the natural world. This is the biggest reason we've ever had to, in fact, take action to prevent the next planetary health emergency, which will be associated most likely with climate change. We now know that it's been demonstrated so clearly that these arguments we used to have about economic problems versus health problems were a false argument. We can see that global health emergencies cause economic downturns like we've never seen before. And so we need to take this moment to change direction. And the voice of health practitioners as trusted messengers, bringing the stories of patients to those tables and presenting climate change in terms of a health threat, which we know from communications research is actually the best way to motivate populations to take action and decisions to makers to take action across the political spectrum, is incredibly powerful. So I'll leave it there, and I look forward to listening to my dear colleagues' contributions.
Thank you so much, Courtney. I'm going to invite, eventually, we'll invite Ariane to come in with some questions from the audience, because I'd really like that conversation to come in. But what I'd like to do first is maybe to turn back. I'm going to return back to James, because I really want to understand more about that research and the link to humanitarian action and how we can actually work a little bit more on bridging that connectivity with medical humanitarian workers like MSF and others. Can you speak a little bit more on that, James?
Sure. Well, let me say that when we think about, humanitarian action, we typically think of major organizations like Médecins Sans Frontières or Red Cross or World Vision or major UN agencies like OCHA, World Food Program, and so on. These are very, very important organizations and have a hugely central role in terms of structuring, if you will, global humanitarian responses. But it's a huge mistake, even within the so-called humanitarian community. It's a massive mistake to think that these are the only actors, these are the only people, the only organizations that can help in situations of crisis. The reality is, and always has been, the reality is that the vast majority of help when a person or a community is in need, the vast majority of help comes from community, comes from family, comes from neighbors, comes from people down the street, comes from people within the same town or city or country. Humanitarian actors or formal humanitarian actors work from outside, usually, typically, of an actual community. And yet they have very particular skills and very particular tools and very particular ways of working that enhance, that strengthen community-based responses. They cannot replace community-based responses. And what we're seeing with some of the changes that are occurring now globally with planetary health crises, what we're seeing is that the scale, the scope, the volume of need is on a massive, massive increase around the world. So there are now about 180 million people around the world who need humanitarian assistance of some form or another. Now, this is more people than at any time since World War II. This is more people in need of humanitarian assistance since that architecture, if you will, of organizations was actually created. of the UN agencies and formalized in terms of relationship with non-government organizations and so on. And so when we think about how do we respond and how do we structure a response, we have to think about who are the actual actors in situations of crisis. Well, number one, it's community. It's each other. It's brothers and sisters, mothers and fathers, friends and neighbors, people down the street, people within your own town and community, people within your own country, and then it's outside assistance persons. And so when we understand that, and we also understand there's a massive increase in need, that then helps us understand how best to approach improving the capacity to respond. And so the very first thing that we're doing, and that I always emphasize with people that I work with, is the importance of community-based approaches to humanitarian assistance and to humanitarian delivery. And that applies to the massive organizations like MSF and to the Red Cross and to the UN agencies as equally as it applies to a little tiny small NGO of self-organized people in the Philippines or here in Toronto, Canada, or elsewhere in the world. So that's the very first basic principle. And then the second basic principle is pragmatism. What specific concrete things can we do? What actions and what tools can we create to improve the capacities of communities to work with major organizations when necessary to actually improve people's well-being in situations of crisis? And so, for example, one of the things that we're working on, we're actually launching later on today, is a new tool that combines artificial intelligence, digital platforms, and biosensors to essentially analyze water for pathogenic contamination, so for bacteria and for viruses and so on, and to determine how much chlorine a person should put in their bucket, a mom who's gone down to a river to get water because of a massive hurricane or other major extreme event that has devastated her normal way of getting water. She now has to go and get dirty water. So for her, how much chlorine should she put in that bucket to kill the bacteria and viruses that may be present? Or that same tool can be used to tell MSF or the Red Cross or whoever how much chlorine to put in their 500,000 liter bladder tank, which is being used in a refugee camp. So we call this a safe water optimization tool, a SWOT, as we're now calling it. And so we've tested this, we've developed this, we've tested it in multiple sites around the world, and we're launching this very practical tool for humanitarian actors in the next day. That's one example. A second, a final one that I'll just talk about very quickly is we are essentially modeling using simulators, computer-based simulators, and again, artificial intelligence. We're modeling the health impacts of climate change in Malawi, and we're also looking to do the same in Bangladesh, and we're also looking to do the same in Paraguay. And what this will help us do is understand the complex relationships between, for example, changing weather, changing patterns of infectious disease, changing food security, and disaster response systems from a community-based approach. Now, if we can understand that complexity, then we can understand how best to intervene, how best to develop new tools, new ways of working together to create adaptations to the impacts of climate change. And they can be agricultural adaptations, they can be health systems adaptations, and also to create better and mitigation strategies.
Thank you so much for that very comprehensive review. I'm going to turn to Ariane with the questions from the audience. If you can give us a few, and let's direct it to our great panel.
Of course. Well, the first one is actually in French. You can respond to them in English, but here it goes. Comment une organisation d'urgence comme MSF, qui répond aux questions du présent, peut-elle prendre en compte les questions d'environnement qui sont des questions long terme?
Quelles sont les questions de
long terme?
À long terme. Did you guys understand that? Basically, how can an organization like MSF respond to environmental concerns with a look at the long-term lens? Anybody wants to volunteer? I'm going to go to Renzo.
Not from MSF yet, but I think I'm MSF at heart, and I've been friends with many of you from this great organization. And so let me offer some provocation. How can we, the humanitarian community, or how can we put prevention at the center of the humanitarian discourse? I know it's a debate within your sector, we're not a development organization, we're a humanitarian organization, and we deal with crisis, we don't prevent crisis. But I think as we now see as James already mentioned, the magnitude is getting bigger and bigger, and the frequency as well, the intensity. How can we make sure these planetary health crises actually do not happen? How can we make sure that the way we measure the success of humanitarianism is not in terms of how much big the response is, or how much money were we able to raise to support, let's say, the victims in the Philippines? Instead, we are, going to measure the success of humanitarianism from a planetary health perspective in terms of averted crisis, disasters whatsoever. Every time I read the Lancet Countdown for the past several years, I'm always afraid that they're giving me more, worrisome news than what they reported the year before. And that's what's been happening. I think the new countdown that we should start is a countdown towards success, because we've been successful in putting prevention at the core and, really achieving healthy people and healthy planet, averting all these disasters that we anticipate if climate action will be delayed or stopped. Thanks.
Excellent. I like that. It's a switch from the threat to opportunity, which Jess had already mentioned in the beginning, looking into successes. Let's take another question.
Of course. So how can you implicate community to solve environmental problems? We can start with Jessica with this one.
Can't hear you, Jess. There you go.
I'm not muted. Can you not hear me? Thank you. So I think Courtney put it really well, that numbers numb and stories stick. And in the Lancet Countdown, we are excellent merchants of numbers, but we really do need to be accompanying this with messages of what this means on the ground, and involving communities in the personal stories that they can share of the impacts of climate change on their health, but also of the solutions, is absolutely vital to be translating these numbers into what they mean in the real world. And behind every one of those numbers is a story. I think when we think about involving communities, it's absolutely essential that we don't see this as some sort of charitable act, because at the end of the day, these messages that these communities have are what is going to save the rest of the world. We can't sit here in privileged London and pretend that the impacts that are experienced on the ground in so much of the world right now isn't what's eventually going to be facing us. So we need to stop now and learn from what's happening in other areas around the world.
Great. Thank you for that. I just wanted to jump off of that question, if you don't mind.
Of course.
I think, when we speak about the community being the first responders, but they're also the ones who are being directly affected, I think we do have a role at large to amplify voices. And I wonder if you can expand on that a little bit more, Jess. And also, I'm going to turn to Courtney to answer that question as well. So, Jessica, how do we amplify voices for those most affected?
So I think at the policy level, setting policy is no longer the sole job of policymakers. It's absolutely essential that for any policy that's being developed, that there are members of the community involved. And that includes youth, it includes the most vulnerable people, whether that's based on ethnicity or gender or income, to really make sure that these policies are serving the people that they're intended for, and they're not defined in a room that's completely detached from reality.
So, Courtney, can you expand a little bit on from your perspective?
I very much agree with what Jess just said. And also, research is one way to amplify community voices. What we see a lot here, we're downstream from the oil sands, and many of the community members, and this is speaking to a different aspect of planetary health, so more local pollution. Those communities and my people here in Yellowknife and further downstream are very worried about potential toxic impacts of resource extraction industries on their lives. And unfortunately, partly because of the existing lack of attention to environmental, ecological, planetary health in general, partly because of fossil fuel company influence, it can be really hard for those communities to get the research done so that they can have the data, which after all is still important, to take to policy tables and say, look, we had this much cancer. We think this much of it could be due to the influence of the local resource extraction industry. We want you to do increased health impact assessments or protect us or simply stop making new projects and make sure you do a good job of cleanup. Without that information, policymakers, what we've seen here in Canada, often minimize the impacts and don't follow through to protect the communities. So lending our skill sets, which I think, in many cases here in Canada, taxpayers helped me to even get through university. So I view it as part of my commitment to citizens and my patients to use every part of the skill set that I've developed in service of health. So doing that research can help amplify the voice, standing beside our patients at media interviews. I've done that before so that media can understand that what this person, community member, says is backed up by their physician, making sure that we take those voices into whatever halls of power we can. At one point, I was very honored to speak at the launch of the Powering Past Coal Alliance at COP with members of my community at the table, Elder Francois Paulette, Dene National Chief Bill Erasmus. And that was with the health ministers and environmental ministers of multiple countries. And so to be able to bring my experience as a doctor serving that community to that table with my community members at the table was really one of the most powerful experiences of my life. And so I think there's many ways that we can lend our voice. Sometimes it requires some advocacy training that we may not have had, or research training, or collaborators, but that's okay. We all learn every day, and this is an incredibly important thing for us to do as we transition from looking at what we do as healers, as what we do inside healthcare structures like hospitals, to looking at our role as planetary health practitioners.
Excellent. I think we still have time for another question from the audience.
Yes, just once more. Well, we have what is the place of research, or the status of research of planetary health really today?
So because we have a researcher at hand, I'm going to turn to James, and maybe I'm going to shoot it also at Renzo. First, James.
Yeah, well, so the state of planetary health research. Well, planetary health itself is a story. The language, those two words tell us about a vision of the future. They also tell us about a relationship, again, between human civilization and our biosphere. So the story of planetary health is about understanding, and it's about choosing particular ways of responding. And so research within that is really about developing the tools, the policies, the practices, the approaches to understanding, and the approaches to interventions. So the idea or the concept of planetary health is, it's new in the Geneva Health Forum. It's new at the World Health Organization. It's new at the Lancet even, and at the Rockefeller Foundation, the two organizations that came together to launch a planetary health initiative within the global health community. But this is not a new idea. This is an idea that's deeply rooted in indigenous communities. It's deeply rooted in traditional communities and their traditional understanding of relationship between community and environment. And so there's a whole wealth of activity that needs to be understood and needs to be described. Those stories need to be told so that we can learn from each other how best to approach the future of planetary health. So storytelling is a fundamental part of planetary health, and actually recognizing that is part of research. And so at my institute, at the Dowdell Institute for Global Health Research at York, one of the things that we've done, and we are now doing for the next few years, is we've launched what we call a Planetary Health Film Lab. And so we're working with youth from all over the world to teach and learn how to make short films using your mobile phone so that you can tell the story, a story of the impacts or the choices around better interventions for planetary health in your community. So those stories are very powerful, and we're linking them to the major policy institutions that Jeff talked about that need to be held to account. And so those short films are being used by policymakers at the Paris Accord COP talks. They're being used by policymakers at the United Nations Secretary General's office, or UNESCO or UNEP, through a digital platform that is linked to the data or the numbers that numb. And you're absolutely right, Courtney, numbers numb. But if you put numbers in the context of a story, the person, the policymaker who's trying to think about how best to achieve better outcomes, they will actually achieve better outcomes if they consider the story. So what we've done and what we're seeing is that policymakers who deal with climate change issues, adaptation and mitigation around the world, are actually very positively influenced by these short stories. And so now, with our Planetary Health Film Lab, we're expanding this to work with, for example, indigenous peoples in the Arctic region around storytelling, use of mobile phones to tell stories. And so that's a part of research. It is the other stuff that I talked about earlier, artificial intelligence and digital platforms and developing safe water optimization tools. That's another concrete element of research. But there's a wealth of activity taking place. And the key issue, really, in my mind, is what is the story, right? The story of planetary health is a story where we can find ourselves in a viable future. We just need to understand the nature of the problem. We need to understand our ability as human beings under our best selves. We can actually work together to achieve better health outcomes in our communities and at a global level. That, I think, is the story that should drive future research.
Excellent. So I said, Renzo, I was going to throw it at you, but I will throw it at you also from the lens of the PH Lab. And then finally, if you can, I'm going to go around because we're hitting the 5-minute mark soon. But I wanted to make sure that each of you had an opportunity to give us one take-home message. You have one sentence each. But finally, answer the PH Lab and the research question, and then give me your take-home message, and then we'll go around the block. Thank you.
Sure. Thanks, Maria. And very quickly, regarding, I really like that James mentioned the word story and film. My doctoral dissertation is actually half written and half in film because I want to make sure that I actually capture the voices of the people affected by climate change in coastal Philippines and make them tell the story by themselves, captured in media. Those films have been watched tens of thousands of times. My dissertation was only read by 3 people, and that is my doctoral committee. When it comes to research, especially in the global south, for several years, I've devoted my time to helping build capacity in the Philippines and Southeast Asia. We're building PH Lab here. We're building the Southeast Asia Planetary Health Alliance. We're building the Planetary Health Philippines. Again, because if we really want to address planetary health problems where they are, we need to prepare and train the next cadre of planetary health scholars, researchers, practitioners, and leaders, especially in the global south. I always say that here in the Philippines, if California has a Silicon Valley, we want the Philippines to become the Silicon Islands of planetary health innovation. And finally, my last word, as you requested, I think planetary health is an invitation to planetary humility. That we are just, part of this amazing fabric of nature. I remember Chief Seattle saying, we are just a thread in this fabric. And so we need to adopt this high degree of humility in the way we, treat Mother Nature, address these contemporary challenges, and ultimately we need to tackle the political and economic forces that shape planetary health destruction. So that's my final word.
Thank you. I'm going to go to Jess for a final word. You have 30 seconds.
I'm partly plagiarizing my final word. I feel it's triggered by the Robert Swan quote, "The greatest threat to the planet is that someone else will save it." I'm going to expand that to the planet and its people and say that, of course, we're all personally responsible for our own actions to reduce emissions. But really, as a policy advocacy person, I would love for us all to be able to make policymakers feel personally accountable and personally responsible for the world that they are leaving, not just their citizens, but their descendants as well. And that this isn't something that's going to be done by someone in another sector or someone in another country or someone in another part of the community. It's on all of us.
Thank you for that. I think Ariane wants to direct one last question to both James and Courtney.
Yeah. So, my next question is for you. If there is one action that we should be implementing right now to improve planet health, what would it be? We can start with James.
I would say I just love the quote that my colleague just gave. What is the one action? I think that the one action would be reflect on this beautiful insight. The greatest threat to planetary health, to the planet is that someone else will save it. I believe it was Robert Swan. Is that who you said was the person who said that? Yeah, that's an incredible comment, an incredible perspective. I think each of us should reflect on that. And really try to understand what is embedded in that thought, and it will, I hope, drive each of us to recognize that this is our personal and collective responsibility to engage a new way of seeing, a new way of understanding, and a new way of being in relationship to each other. And in relationship to our biosphere. And that if we are able to do that, to create that new way of understanding and being, planetary health, the future of planetary health is truly, truly bright. But if we're not, that is the greatest threat to health and well-being, is not recognizing our responsibility to engage and to reshape the world into what it can be.
Great.
Thank you so much, James. Now this question goes for you, Courtney. The same one, really. Is there a specific action that you think should be taken to improve planetary health?
Thanks. And I, first of all, it's natural for this moment in time to be upsetting and worrisome to people. There's an entire body of work developing around ecological grief and eco-anxiety, and I've been lucky to work with some really wonderful thinkers. Ashley Consolo, who James and I both did some work with around wildfires, has done a lot of work as well. And what we see is that action feels better than anxiety. So coming together to work on these issues reduces the sense of solitariness that can really be a double problem associated with this, by sharing stories, sharing our concerns, and then taking productive action in service of planetary health. It gives people a feeling of empowerment as well as solving the problem. So committing to doing the work is a key step. Action feels better than anxiety. And something that Renzo and I both worked on recently was to propose a planetary health for health professionals in the Anthropocene. And I'll just read you the first line. It was published in the Lancet recently. It says, "I solemnly pledge to dedicate my life to the service of humanity and to the protection of natural systems upon which human health depends." And for me, the act of even making that commitment, Elder Francois Paulette, a Dene elder, talks a lot about the importance of ceremony. And he also views this moment in time as a moment where Mother Nature has told us, hey, we need to change our ways in order to live well together. And so to take this moment in time, this coronavirus crisis, to be that moment where we turn, to make that commitment to one another, to say aloud that we will, with an oath, with other commitments, is powerful. And that is the start of the safe and healthy path we need to take us through the century and beyond.
Thank you so much, Courtney. And with that, we bring this session to an end. Indeed, this has been one of the most urgent discussions that we've had at the Geneva Health Forum so far. I really do hope that now we can turn these conversations into meaningful actions. So thank you so much to our speakers. Really, your passion, your energy in this panel has been almost palpable, and it has really, really been very rich and enlightening to hear you all. Thank you all for watching, and please be sure to join us in our next panel about increasing timely availability of medicines in Africa. But first, enjoy some yoga courtesy of the Indian government.
Dear friends, on behalf of Ministry of Ayush, Government of India, I welcome you to this short yoga session. We will do 3 yoga exercises which you can easily practice sitting in front of computer screen. Boat pose. Precaution. Person suffering from hypertension, abdominal pain, abdominal hernia, recent hip surgeries should avoid practicing this asana. Practicing method. Sit straight. Place your neck back erect. Deeply breathe in, lean back. Hold the edges of the chair with both the hands. Slowly breathe out. Stretch your leg to ceiling one after other. Try to keep your knees straight. Hold this posture for few breaths and breathe in. Bring the legs down and relax completely. Repeat it for 3 to 5 rounds. Benefits: strengthens abdominal and thigh muscles, reduces abdominal fat, improves digestion, relieves from the constipation. Now we will practice Pranayama, deep breathing exercise, Surya, Anuloma, Viloma. Precaution: person suffering from hypertension, severe gastritis, epistaxis should avoid this practice. Practicing method: sit straight, keep your back, neck erect, relax your shoulder, adopt Nasika Mudra from right hand, close the left nostril from the ring and little finger, slowly and deeply breathe in and breathe out from the right nostrils. Try to feel the cold air entering and warm air coming out of nose. Repeat it for 5 to 7 times. Benefits: relieves from all sort of pain, reduces overall body fat, relieves from productive cough, running nose and bronchial asthma. Surya Bedana Pranayama, right to left nostril breathing. Precaution: person suffering from hypertension, severe gastritis, epistaxis should avoid this practice. Practicing method: sit straight, keep your back, neck erect, Relax your shoulder. Adopt Nasika Mudra from right hand. Close the left nostril from the ring and little finger. Slowly and deeply breathe in from right nostril. Breathe out from left nostril by releasing the left nostril. Repeat the practice. Breathe in from right. Breathe out from left. Try to feel the cold air entering and warm air coming out of the nose. Repeat this for 5 to 7 times. Benefits: relieves from all sort of pain, reduces overall body fat, relieves from productive cough, running nose, bronchial asthma. Thank you for practicing. Enjoy the GHF session today. For any queries, please reach out to Embassy of India.